Hello, and welcome to Sparkling Diamonds with Brittany and Robin. I'm Robin. There's no Brittany here. And if you could see this camera setup, you would die laughing, okay? I am already probably one of the most, what should I say, technology challenged human beings. I mean, I'm good at technology, obviously, so I have to be to some degree, but not this video recording stuff. So I have a lamp here, a, a lamp ring there, a mic there that I'm not even sure is working, and I'm pointing there, and I guess to you it looks there. And then I have my computer where I can see me recording from my iPhone. So yeah. Where's Brittany when you need her? Brittany is actually having a good time, I hope, in Charlotte, North Carolina. She's on vacation there with a friend. So, what I thought I would do is, this is a WIP&CHAT, which means I'm going to be working on a diamond painting that I've been working on, which is a work in progress, and I am going to chat with all of you. So, I have done probably 4 WIPs or WIP&CHATs. I just like to call it talking to you while I'm working. So I've done about 4 of those, talking to you while I'm working. And I think the only ones that have officially made it on YouTube it's 1 or 2 with Brittany. The live, obviously, I wasn't diamond painting, but I was chatting. And I'm not diamond painting right now in case you can't see. But the other ones, I am diamond painting and I'm talking a lot. And I just don't know. Like, there's a part of me that, like, afterwards, I am so judgmental on myself. It's weird because, well, for those of you who have been watching Brittany and I for a while, and you know, I am a psychiatric mental health nurse practitioner in the doctor of nursing program at Duke University. So I'm on camera a lot, all day. And actually, I had to do a presentation today where I actually had to dress up. And this is not what I was wearing, by the way. I was really dressed up. And yeah, and look like a real person. And I was really nervous. Now, that was at Duke. So when it's different being doing a presentation in front of a bunch at Duke University. That would be challenging for most people, I think, because everybody there is so very smart, right? But when I'm on camera, so I have a private practice where I wear my psychiatric mental health, for those of you who don't know. And so I do in-person and telehealth. And so I am on camera during telehealth. But I don't look at myself on camera during telehealth. Like, I make sure I'm presentable. And then I focus on my patients. So it's not like I care that much how I look. I care how I sound. And I hope I come across as empathetic and caring. And because I really do. And I really am empathetic and caring. And that's all I care about. This is real life, because if I look different to you twice now, that's because my camera has fallen over twice now. And if you're saying to yourself, Robin, why is your camera falling over? It's because I have the new iPhone and it won't fit in any of the things that you hook to the ring lights. And that's the problem when you get a new iPhone. Like, you have to get a new everything. iPhone is set up like that. All right. So, if you are new here, welcome. Because I'm sure you're wondering what's going on. I wonder that almost every day of my life. And if you are returning a subscriber and you're used to our channel, I bet you're asking yourself, where is Brittany? Which is a good question, right? Why is Robin alone? So if you are returning, thank you so much. We are so appreciative of all the support and generosity that has been shown by our YouTube subscribers. I cannot say enough what it means to be returning comments, reading the comments and replying, I should say, to the same people every week and learning their names with their photos. And that to me is so important. And that is what makes this so fun. Yeah, like that just, it's just, it's just like real. We were honored to be guests on Ditsy's Diamond Den with Ditsy and Paul. And one thing I was saying is you can't fake this. Like, there's no faking it, you know? I feel like with YouTubers, they come across as genuine and they're like, oh, I love everything. Everything is perfect. You know, when you go to TikTok or Instagram and they're trying to sell you everything, everything is perfect. Oh, my kitchen is so organized. My bathroom is so organized. My diamond painting is perfect. All the drills are perfect. This picture is perfect. No, that's not the real world. The refrigerator can be chaotic. The bathroom can be a disaster. It can be a diamond painting that you regret buying. The drills are not working right. The glue is not working right. And that's the thing about Brittany and I. It's funny I say this because as I do, I've got the TV on pause, and it has my photos going across the top. And what is in front of me is me and Brittany at the Faith Hill Tim McGraw concert in June 22nd, 2018 from Daily Memories. And there we are sitting together in front of Tim McGraw and Faith Hill's mic, sitting across from one another. In case you can't tell, Brittany is dear and near to my heart. She's my only daughter. I have 2 sons. She's my only daughter, and she is special. So what I thought I would do is I would work on a diamond painting, if that's okay, because that is what our channel is about. And if you are newer to our channel and you think you would like to stick around and see what this is about, because I'm sure you're very confused right now, please hit that subscribe button. And if you think you might like the content, you can always unsubscribe if you don't. and sign up for notifications, and I bet the next notification Brittany will be with me, and you'll be like, oh, that's why she has people that keeps coming back. So anyway, yeah, so I hope all of you have had a good week, and how are you all doing? You know, I will say one of the things about, and I'm going to start diamond painting. Let me tell you what I'm working on before I just get into chatting here. Because that is what our painting is about. It is about diamond painting and how it fulfills my heart and soul. And it fills my heart and soul. And I can't explain it. Like, I love it. I could do it 24/7. And Brittany and I joke about this all the time. Who needs to work? We just need to diamond paint all day. I'm going to make a shirt that says that if there isn't one already. But what I am working on, this is really a mess. Like, this is not, okay, first of all, I'm not in my office and I'm not in our diamond painting place, okay? But Brittany out of town, I'm actually in a different room. And this right here is the curtain, which probably is very distracting to you. And behind me is a bookshelf which is probably even more distracting to you. And over there is a doggy toy, and all my doggies are on the bed. Actually, I only see one on the bed, which is rather scary because, well, one's in the dog bed. I guess that means I haven't scared them all off because they think I'm talking to myself. Yeah, so we have a house full of Yorkies. So what am I working on? I'm actually working on, I'm doing a Randy Spangler event, and this is called Nap Time, and I am actually almost done. So I started this. I'm almost done with Trick or Treat House. And first I was going to finish it because I thought it was the required size. But they asked if I could do a new canvas. So I deleted that photo and said, sure, I'll just do this one. And then if I finish this one, I'll go back to Trick or Treat House, even though it's Thanksgiving, because I don't care what season it is. If I love the diamond painting, I'm just going to diamond paint. And so Nap Time by Randy Spangler. And this has been a lot of fun. Isn't it pretty? Diamond Art Club. And who doesn't like Randall Spangler? I'm actually going to get a couple of his, I have one of his books. But I'm actually going to order a couple of his books and have them sign them for my office for kids, because I work with adults and children, and I thought it would be a good idea. So I'm going to do that probably after Christmas, because that's just for a me thing for my kids. But thank you to our subscriber who told me about a glue stick would hold my washi tape down, because it worked. And see, that is what I love about YouTube. You learn a lot of things from your viewers that you don't know. And I will say something that I don't normally do is I'm working on Randall Spangler on top of Hannah Lynn. And if you're asking yourself, Robin, why are you doing that? Now, I'm not working on them both at the same time. Please don't be confused. I thought when I finished this, I would go back to my Hannah Lynn, because Brittany and I are doing a comparison project, which I will have her leave the link below and you can follow, where I am doing the Diamond Art Club version of Groovy Girl, and Brittany is doing the Art and Soul version of Groovy Girl, and we're doing a comparison video. And we've already done like 3 or 4, and we're getting ready to do another one. So I do not know when this video will go up, but I was getting ready to say today's Friday, and I think it's November 22nd. I went to look at my phone to see, but I realized I'm recording with my phone. I think. But it's Friday, and next Thursday is Thanksgiving, and that's what I was going to say. So I'm using a Yellow Dog tray. I have 2 of them here, a purple one and this one. Purple is my favorite color. And then I kitted up. We did an unboxing. So my camera is propped up by one of the boxes. But Forever Young is a company on Amazon. I'm trying to find the lid. Oh, there you go. Forever Young is a company on Amazon that has these very cool diamond painting storage trays. And so I have kitted up Randy Spangler in these, and that's what I'm working on. So that's kind of why, like, there's boxes around. I don't know how many boxes you can see, but there are boxes. Now, I ordered this one, which has 15 in it, and then I ordered one which has 45 in it. But I used the this is real life. I'm not going to edit that out, because if I did, this would not be me, okay? The one with 45 took a few days to come, so I wanted to get to work, so I just did this. So what I did was I kitted up what few I needed left in these, I think they're called tray bricks. It has slipped my mind. That's horrible, but I don't have the box of them. But I love them. They supposedly remove the static from your drills. And so I didn't quite have enough. And so I had to put some of them in here. Now here's the dilemma. I lost a sticker. So it's the only sticker that I've lost. So 1, it's going to reappear, okay? Or 2, I will use every color that I need. And if I have one that I'm missing, I know it's this color. So I'm not at all worried about that. All right. Now that you've seen my disaster of a setup, let's start diamond painting. So I bet you're saying to yourself, Robin, are you really at Duke University in the Doctor of Nursing program? And are you really a psychiatric nurse practitioner? You seem so disorganized. I am not disorganized at work. At work, I am together. I have my office set up perfect. My office, if I ever recorded from my office, it is so neat and organized, and it's perfect. It really is. Like, seriously, I love my office. But here, when I'm diamond painting, I just lay out the stuff I need. And yeah, I like being in the craft room, but obviously, that I decided to not be in the craft room because it would be too hard to record in there right now. So, what I was saying before I went down, I forgot I hadn't told you what I was working on. What I was saying was, next week is Thanksgiving, and I know Thanksgiving for some people is really hard. And so I want to say to everybody, I hope you have a wonderful Thanksgiving. But I know for some people, you may not have family and loved ones, and it's just another day to you. And for those people, I want to say, my heart is with you. And I sincerely mean that. I'm hoping Brittany and I might be able to jump on for a live over the Thanksgiving weekend. That would be so cool, but I don't know. We have plans, and so I don't know if that's going to happen or not. We'll see. We are actually visiting my in-laws for the first time in a while. They come and visit us, and we were there over the summer, so we haven't been there for several months now. It was warm when we were there last, and it's actually snowing there right now, so I'm really excited. I hope it snows when we get there. I'll send you some photos. I didn't like snow when I lived there, but I love snow now. So, yeah, Thanksgiving is a hard holiday for some people, and I recognize that. And if you're one of those people, I hope that you find something that you enjoy yourself and can find some happiness, something that brings you joy, whether it is diamond painting or watching your favorite YouTuber or your favorite movie, or doing your favorite craft, or going somewhere that you love. I hope that you can find something that brings you joy on that day, and not make it quite so lonely. So, I'll tell you a little bit about my week. Brittany and I normally talk about a week on the Thursday night roundup. So for those of you that don't know, we do Art and Soul roundup every Thursday night, and there's something wrong with the drill, so I'm taking it up. We do Thursday night roundup for Art and Soul every Thursday night. I think I said that twice. And we love it. We love Art and Soul. And Art and Soul they are a great company. So if you haven't checked them out, go check out their Facebook page, hang out, check out their website. I would highly recommend them. Melissa and Scott, they go above and beyond to make sure their customers are happy. And they are a small business just getting started. And they have a busy life trying to run that company and do other jobs while they get Art and Soul up and running. And so go support them and check out their diamond paintings. And I'll talk a little bit about that too while we're doing this. But some of the diamond paintings I love there. Some things that are coming up with Art and Soul. But yeah, so this week, we really didn't talk about our week much on our roundup because we were talking about other things. I don't remember what. But this week, actually, the last couple of weeks, I'll be honest, it's been really hectic for me. Work has been very busy because this time of year is very difficult for a lot of people. And because of work being difficult for a lot of people, um, I have an increase in people seeing me for medication management and therapy. And that is that is the reality of people that are depressed and anxious and I mean, whether you have a family or whether you're not, whether you don't, or your family's kind of dysfunctional, being around that family can also cause some issues. So it can be stressful. It is a happy time, but it can be a stressful time. And so I actually see business gets kind of busy around this time of year because people are trying to learn how to deal with going home and seeing family members they often don't get along with, or you know, just being alone, the stress of feeling like you have to buy everybody a gift when you don't have a lot of money, and that kind of social pressure I feel that's been put on us that I think is very wrong. And so I do understand and what that can be like. Yeah. So one of the things I thought, so when Brittany and I started our channel, and if we ever make some of my WIP&CHATs live that I've done that I've kind of holding back that I'm not sure about, when Brittany started this, I was starting a YouTube channel about mental health and psychiatric mental health nurse practitioners. And one of the things that occurred to me, Brittany immediately called this Sparkling Diamonds with Brittany and Robin. And the first video she recorded without me. I think it was the second or third video when I finally recorded with her, but I was a bit nervous about it. And so we've came a long ways. I'm very proud of her for doing that too. She's kind of an introvert. I said this during Ditsy's show, and it's really true, Ditsy's Diamond Den. Everybody likes Brittany. She's like one of the sweetest people you'll ever meet. But she is kind of shy and an introvert. She's nothing like me, that's for sure. Not that I would say I'm a little introverted. I don't know, ask Brittany. So anyway, one of the things I thought, so the past week, let's stay on track here. I'm not using notes because I'm wanting this to come across as sincere, so I have no notes. One of the things over the last week is a lot of people are also dealing with physical illness. There's a lot of respiratory stuff going around here. It was actually on the news. A lot of kids and adults are getting pneumonia, strep throat, the flu. And my son actually got walk-in pneumonia and had to be hospitalized last Sunday. But he had strep throat twice, and he was on 2 courses of antibiotics, and he just really wasn't getting any better. Well, he would start getting better, and then he was like, I have him sick again. And so by the third time, his doctor, I don't think she knew what to do. And, his strep was negative, his flu was negative, his COVID test was negative, and they were like, well, I don't know if they didn't, he went there for blood work. I don't guess they checked his O2 stat. So he drove to the emergency room, which is about an hour and a half from where he lives to where we are. And I do not know how he did that. When he got there, they took him back immediately because his O2 stat was in the 80s. His blood pressure was extremely high. They put him on 4 liters of O2, and they did all those same tests, all come back negative. Did a chest x-ray, came back negative, ended up admitting him and found out about 24 hours later he had walking pneumonia, which, by the way, is highly contagious. And so he is at home now, and he has told me every day he's getting a little bit better. He's still not 100%, and it'll probably take a while. You know, being sick for 6 weeks takes a lot out of you. He looked horrible on Sunday night. He could not even hardly walk to the bathroom. He had to have the O2 tank with him to walk to the bathroom. And he's a young person, and that is so scary to see your kid that sick. There is nothing you can do, and it is probably one of the most hopeless feelings in the world. And if you're a parent, you will know what that feels like. Yeah, so Brittany and I were in the ED Sunday. Brittany was doing some stuff before she left and checking in with us. And I'm reaching over to get a collar. The calls are everywhere. The calls are my setup. Tray bricks, that's what these are called. I don't know what I call them, but they are tray bricks. And they are awesome. Can I just say? And if you notice, one of the things about both Tray Bricks and Forever Young, I'm not having to put them in my yellow dog. I just work right out of this because this is a lot of, there's not a lot of multi-placing. So for those of you that are new to diamond painting, you have paintings that have multi-placing. That means you can put down a lot of diamonds at one time. And then you have paintings that are confetti, which means that you have to change colors real often. And this is kind of a mixture, but I would say it's more confetti than it is multi-placing. So it's kind of neat that I'm not having to constantly, you know, pour them in and pour them out. This has saved me a whole lot of time. So I do recommend Tray Bricks, and I do recommend Forever Young. I've really been pleased with Forever Young. I had never heard of them and saw it on Amazon and thought, oh, let me try it. And because the neat thing about Amazon is you can always return it if you don't like it, right? And so what did I have to lose? So I got them and I love them. Brittany hasn't really tried them, and she's kind of mixed right now about her feelings about it. We'll keep you updated. So yeah, between my youngest son being in the hospital and that being very stressful, and working because I did not take off work, and me being a full-time, well, I guess I'm considered part-time this semester, a part-time student, but it feels full-time at Duke University. It's been a whirlwind. The semester is wrapping down, and it becomes really busy towards the end of the semester. And today I had to present my DMP project proposal. And so what that means is when you're a doctor or nursing student, you do a study of something that you're interested in, and then after you do, you pick out what you want to study and try to improve upon. And then after the study, you publish the results, whether it shows an improvement in what you're studying or whether it shows that it didn't improve in what you're studying. You try to get it published. So I thought I'd talk a little bit about that. We are 30 minutes in, and I don't want to keep you here all night, but I think diamond painting there's a correlation between a lot of the diamond painting community and mental health. One of the things that was brought up in Ditsy's Diamond Den during the live where Brittany and I were guests was how many people had anxiety, obsessive compulsive disorder, depression. And we were talking about that, you know, because Ditsy brought up I was a psychiatric mental health nurse practitioner. And I talked about I had been a nurse for a very long time. And I remember when I started being a psychiatric nurse in the 90s, there was a thing called art therapy in the hospital. And I thought I was so envious of the art therapies, the art therapist, her job, because I thought that would be so fun. Every day she planned some kind of craft or hobby or activity the patients would do, from collages to working with clay to, it could be coloring, it could be, gosh, there's so many things. It was activities that, you know, a lot of times when you're engaged in an activity, you talk about things, or if you're drawing, like if you draw something that somebody gives you a topic and you just freestyle draw, even if you're not an artist, something comes out that, is bothering you. And it's a way of expressing emotion and feeling other than words. And sometimes words are hard. And so arts and craft was the way of doing that. And so that arts and craft hobbies, I would say, have always been, well, not hobbies. That's not the right word. Things other than talk therapy have always been a part of mental health treatment. Like I remember there was my mentor, where he worked, their activities therapist took the client outside and they did a garden. And they really enjoyed that. And some hospitals have horses, and you ride and you take care of the horses, and that's part of your therapy. And one of the things I talked about during the live was, and one of the things that Brittany and I've talked about, is starting a diamond painting therapy group. I think that would be really helpful and therapeutic. And it is, I think it's something that's very much needed. And so that brings me to my DMP project. So when I started my DMP program, I remember my DMP committee chair, who is also a psychiatric mental health nurse practitioner. He did, we all had to take a course on mental health first aid. And one of the things that we covered in mental health first aid was a concept. There is a kind of psychology, like, you learn, I don't know that you do know, I shouldn't say but there's different kinds of therapy. Like there's cognitive behavioral therapy, there's dialectic behavioral therapy, there's just plain old talk therapy, and then there's something called positive therapy or positive psychotherapy. And one of the things, the concepts that came up in that was something called 3 good things. And a study was done, and I will try to remember to get Brittany to post the URL to the professor, who was actually one of my committee chairs, who talks about this. There was a study done that found if at the end of every day, if you think of 3 good things during the day before you go to sleep, then it could be as effective as an antidepressant. So they took this study and did it longer than like a week, and they found it was actually more effective than an antidepressant, meaning that if you ended your day thinking of 3 good things, it can help change your brain chemistry as much as an antidepressant. And so I thought, yeah, right. And so I thought, I'm going to do it for a while. So there's a tiny URL, the tiny URLs where you can sign up. So that is actually in the YouTube video that I'll link from Duke with a professor talking about it. You can sign up and get daily reminders to do 3 good things at the end of the day for 2 weeks. And so day 1, I struggled to find, to figure out 3 good things. And I mean, I am not a complainer. I think, I have a good job. I would say for the most part, I am a happy person who, has some social anxiety, but overall, I am pretty happy in my day-to-day life. And I remember that first day trying to think of 3 good things. I was struggling. And I remember I sat down and I came up with something like, I had lunch with Brittany, played with Portland, my Yorkie, and something else that was really small and I thought kind of, not something I would, it was enjoyable, but yeah, it was a good thing that happened that day. I can't even remember it right now. And so I thought, okay, whatever. Well, as the week went on and I kept doing this, during the day, I remember I had this, like, just one day, it was a warm day. It wasn't quite summer. And Brittany and I was walking around a lake at a park locally. And it was beautiful. And we were on a park. It was kind of like, there was a beautiful lake. It was beautiful walking. It wasn't too hot. And we were having such a good time. And I remember thinking to myself, we were talking, there weren't a lot of people. And I remember thinking to myself at that moment, I'm putting this on my 3 good things list for the night. And then I thought to myself, well, why am I putting it on my 3 good things list? And I kind of looked around and all the things I just described, that was why. The birds were singing, it was pretty, it was nice to be outside, it wasn't really hot, the lake was beautiful, I was with Brittany, it was a good day, and I was thankful for that. So I put that on my 3 good list. And then another thing was, I remember I had lunch with a friend. And that is something that I don't get to do often. My schedule is really packed. I really don't even get to do lunch a lot. I grab something to eat and, eat and do notes and go about my day. But I had kind of a long break with a friend and we caught up and chatted and it was so much fun. We actually sat outside that day. And again, I thought, I'm putting this on my 3 good things. And then I thought, why am I putting on my 3 good things? And that was why. The things I've just talked about. Being outside, being with a friend, not being stuck in my office, actually having a real lunch with this human being I could talk to, and not seeing her in a while, and it being like she's a genuine friend and a genuine conversation. And then later on that day, I took Portland. And Portland is a service dog. Portland is she's one of our Yorkies, but she's a service dog. And I took her, I don't know where she is. Oh, she's probably laying in the floor in the bathroom because it's cool and she's big and fluffy. And she lays in there. But I took her for a walk, and she is so happy when she goes for a walk. And if she's near water, she's in heaven. And I thought to myself, this is going to go on my 3 good things for the day. And I thought, why? While I was doing it. And so what I realized was, instead of laying awake at night, trying to figure out what is a good thing that is happening, that's happened during the day, is I was actually present in those moments of those good things happening. And I was taking time to take that in. And so at the end of the day, when I was talking about writing down, like, you could text, you write the 3 good things, you get a text, a reminder, it says write down 3 good things that happen. And I wrote down those 3 good things, and I knew why it happened. And suddenly it clicked, like, this is about, not so much about, at the end of the day, struggling for what I enjoyed that day, but realizing during the day there are moments or opportunities that we all have where, whether it's our kids playing or they say something funny, or there's, we see something that we haven't saw in a while, like a friend or a TV show, or a movie that we haven't seen in a long time, or a neighbor, or somebody does something nice for you, and in that moment you take it in, and every day you do that for 2 weeks, it does begin to change your brain chemistry. There's something about thinking about 3 good things every day that begins to change the way that you think. And when I started implementing this in my practice, I would say to my patients, I would tell them about 3 good things, and I would say, did you do the 3 good things last week? And they're like, no. Did you take your medicine? I took my medicine every day. Didn't do 3 good things. And, medicine helps, okay? But medicine can only do so much. You need medicine and therapy, and you've got to figure out what it is that you're medicating. It's like somebody who uses alcohol or drugs. They're self-medicating, right? And until you figure out what are you self-medicating, you're never going to be able to break that cycle. And so that's why when another patient comes to me, so some of my patients are seeing me for med management only and not therapy. And one of the questions when we're doing screenings is we ask all our patients, are you in therapy? And I encourage them to be in therapy, because I tell them this: medication is going to help, but medication is not the cure. Therapy is the cure. Yes, if you have a disorder like schizophrenia or bipolar disorder, you're going to need to be medicated. And don't misunderstand. But, if you are depressed and anxious, there are ways that you can help overcome that depression and anxiety in addition to medication. And also, there are things that happen throughout our day that can push bipolar people into a manic depressive episode. And, if you think about 3 good things every day, and you learn to handle your stress, you're less likely to feel stress and therefore less likely to have manic depressive episodes. And then there's things like, most of my clients have comorbidities such as migraines, irritable bowel syndrome, fibromyalgia, Lyme's disease, premenstrual dysphoric disorder. And there's a reason why these comorbidities exist with depression and anxiety and other mental illnesses. Like, we have to take care of our whole body. There's a reason we have to do like holistic care. I suffer from migraines, and I know, while I take medication for my migraines, I know my migraines are less whenever I'm less stressed. If I'm really stressed or worked up about something, then I'm more likely to get a migraine. Now, with all this said, I want to say, and I probably should have said this at the beginning, because I'm sure I'm going to get a comment. I am not in any way giving you medical advice. You need to seek out professional help if you're having problems, okay? I am a mental health professional that has her own patients, that tries to help them, that gets to know them really, really well. And I tell them, I offer them solutions, I give them solutions. They're in the driver's seat, and they get to choose which path they take. And if they want to be on medication, if they want to just do therapy, if they want to do therapy and medication, that's totally up to them. And so, my YouTube family, I don't know you, and, but I would say if you are suffering from depression, anxiety, substance use disorder, bipolar disorder, eating disorder, any of those illnesses, I would say find a good therapist. You would be surprised what therapy would do. And one of my mentors, he tells me this all the time. He thinks everybody should be in therapy somewhat. Everybody needs therapy, like once a month, once every 3 months, just to talk through things. It is helpful sometimes just to go in and say, I'm having a hard time at my job. Or right now my life stinks. Sometimes just having that person to talk to is really, really helpful. And so I would encourage anybody out there in our YouTube family to actually seek out a medical provider. And that leads to another good point, and this is kind of where we'll leave it, and that is, Robin, how do I find a medical provider? Wait lists are so long. Like, where do I even start? So let me tell you. The first place to start is with your primary care provider. You make an appointment and you sit down and you tell them that how you're feeling and what you think is wrong, and ask for a referral to a therapist. Whether if you want to start with just a therapist, or whether you say, Doc, I need to be on medication, they may give you medication and refer you to therapy. I would recommend both. If it was somebody coming to me, I would say therapy and medication, because the medication's just the Band-Aid. But, primary care is a good place to go. And then a lot of times people don't understand the difference between what's a psychiatric mental health nurse practitioner, what's a nurse practitioner, what's a medical doctor, what's a psychiatrist, what's a physician's assistant. Let me help you out. So the people that are trained to provide mental health services are psychiatric mental health nurse practitioners, psychiatrists, psychologists, licensed clinical social workers, marriage family therapists, those kind of credentials. The two people that can prescribe medication to treat depression and anxiety and other mental illness are psychiatrists and psychiatric mental health nurse practitioners. And in some states, psychologists can prescribe. There's a lot of restrictions, but in some states, psychologists are prescribers. It's really rare. But your primary care can prescribe. Pediatricians can prescribe. I'm talking about antidepressants. But usually what they'll do is they'll give you an antidepressant, but if it doesn't help, they can't see you every week, and so they're like, here, try this, come back in 2 to 3 months. And I find a lot of people give up. That's not the way to do it. You should have a provider that puts you on a medication, checks in with you every week till you get that dose, at a dose where you're not having side effects and you're tolerating it and you're really feeling better, and we know the med is working, and then go to see the provider every 2 to 3 months. That is how a good, in my opinion, and this is all my opinion, but a good psychiatrist or a good psychiatric mental health nurse practitioner is going to provide care. They're going to see you, evaluate you. They may not even prescribe in that first appointment. They may just be getting to know you and try to figure out what's wrong with you. Because if somebody sits down in 20 minutes and tells you that you have bipolar disorder or ADHD based upon a 20-minute assessment, I think I would be questioning that. I would be like, how in 20 minutes do we come to this conclusion? So I tell my patients sometimes, in 50 minutes, I may know more about you and enough to like know what medication you're on and know if we should change it, start tapering you off or increasing the dose. But for the most part, somebody coming to me wanting a diagnosis, wanting to know what's wrong, it can take 3 to 5 sessions to figure that out. And it can take 3 to 5 sessions to even get somebody to open up and trust me. And I don't blame them. I don't know that I would sit down and pour my heart out to a total stranger in 15 minutes. And by the way, my appointments are not 15 minutes. When I get to know my patients, they are all 45 to 50 minutes. And then once you're medicated and you're stable, and if you are in therapy, I see you every 2 to 3 months for 25 minutes. If I'm doing therapy, I see you weekly, bi-weekly, monthly, whatever, for 50 minutes. But that whatever is what you want. It's what you need. And that's what I want you to take away from this. You're in the driver's seat. And when you're the biggest advocate for your health, for your children's health, for your family's health, there's nobody that knows you better than you. And so, if you ever do have a question about how do I navigate this crazy mental health system to find a provider, reach out and send us an email, and I will I can say, go to primary care, or especially if you live in North Carolina, I can tell you where to go to begin. Like, primary care, we have what's called, they're crisis centers or evaluation centers where you can go in and get evaluated, and they can start you on the medication, set you up with therapy, and that by the time you leave, you will have an appointment with a therapist and hopefully with a prescriber. And also it takes time to find the right fit. I'm not the right person for everybody, and the person you see the first 1 or 2 times might not be right for you, and that's okay. It is okay that I'm not right for everybody. I know that I'm not the right person for everybody, and I tell that to my patients. But it's important to communicate that to your provider. If you don't think they're right for you, I would say, I think we're on a different page. I think I might need a second opinion, or just go find a second opinion and say, hey, I'm getting a second opinion because I think me and my provider are on different pages. What do you think? Here's the history. All right. That was a lot of talking. And I hope you really enjoyed this, and I really hope you found it helpful. If you did, leave me a comment and let me know. Did you find it helpful? Do you find it hard to navigate the mental health system where you live? Where do you live, and do you find it hard to navigate the mental health system? One of the great things about being at Duke is I have students in other countries, and it's so interesting to learn what it's like in like the UK to navigate mental health care. And mental health care is not a priority in most countries, including the United States, when it should be. I'd be happy to give you the roadmap. While I won't give you medical advice, I can give you the roadmap of here's what I would suggest. Go to this person and see if they can give you some recommendations. Is there a behavioral crisis evaluation center in your area that you can go to and get a follow-up recommendation? But here's what I hope. I hope we can do other WIP and chats, or work on pieces of art together in chat. And I hope that I can offer you something that you can take into your life, and it can fill your cup for the better. That is my wish. Because when we started this channel, yes, I love diamond painting and I'm passionate about it, but I love mental health, and I'm even more passionate about mental health. So combining the two for me is like a dream. So if you find this helpful, let me know. And if you didn't, let me know that too. You know, it's not for everybody, and I get it. And maybe you aren't somebody who doesn't feel like you just diamond paint because you want to diamond paint and your life is wonderful and you don't need to hear any of this. And if that's true, that is super, and I am so happy for you, and I sincerely mean that. All right, guys, have a wonderful Thanksgiving. If this comes up before Thanksgiving, have such a nice holiday, even if it doesn't, because I'm sure it'll come out before Christmas. And I will see you in the next WIP&CHAT. I wish all of the YouTube family a happy, wonderful week. And I thank you so much from the bottom of my heart. And I really do mean that. Thank you for sitting with me for the last hour, keeping me company. Bye. And I will see you in the next one.